We are a cautionary tale of what can happen without this legislation. Last year, we worked at 2 full-service hospitals, Quinn City Medical Center and North Adams Regional Hospital. A year later, both of these hospitals have closed. Last March, a former colleague of mine from North Adams sat here before this committee testifying in support of this legislation. She talked about how great the divide was among the rich hospitals and the poorer hospitals. She talked about how some hospitals were making money off public dollars while others were relying more and more on inadequate reimbursement, and that if something wasn't done, communities would lose essential services. The very next day, we were informed that our hospital would close in 3 days. Over a year later, we still do not have a full-service hospital in North Adams. Community members must drive anywhere from 20 miles to 28 miles to get to the nearest hospital. Many of these patients are elderly, of lower economic status, and this creates a great hardship. Meanwhile, the accountants in the Cayman Islands, meanwhile, the closest hospital, Berkshire Medical Center, posts healthy profit margins, maintains accounts in the Cayman Islands, and compensated its CEO over $2 million according to the most recently available data. There is something wrong with this picture, especially when you remember that a good chunk of this money is coming from our public dollars. I am not an expert on what a hospital CEO should be paid, but I do know what happens to the community without a hospital. I don't know why a hospital needs to stash money in the Caribbean, but I do know that if some of it is my tax dollars, that I have a right to know how much is there. And I don't know why nonprofit hospitals have to post millions of dollars in profits every year, but I do know that sick people need and deserve care. And it doesn't matter where they live, or the closest hospital is wealthy, or just struggling to get by. It should matter that they need an operation, physical therapy, or mental health counseling. You have the opportunity through this legislation to address many of these problems, and I hope that you do so. I hope that we are not back here again next session talking about more hospitals that have closed, as more hospitals have posted record profits. Thank you.